good? All right. Well, good morning, everyone, and first and foremost, I'd like to thank you for being here today because the story you report today could potentially save lives out here. This is a message to parents, families, schools, places of worship, and public institutions to be on the lookout for signs and symptoms of the latest health crisis that is killing an average of 160 people a day across our nation. And I'm talking about deaths from drug overdoses. More people died from drug overdoses in 2015 than from motor vehicle accidents. But today, I'm specifically talking about overdoses attributed to heroin and opioids. According to the Centers for Disease Control in 2015, which is our most recent data, 91 people per day died of an overdose of either opioids or heroin. In the past, prescription opioids were blamed for the increase in deaths from overdosing. However, the head of the CDC recently testified before Congress and attributed the dramatic increase in overdose deaths to heroin and synthetic opioids. And those increases are largely due to illicitly manufactured fentanyl. We have not yet seen this level of devastation in Los Angeles County, but it's clear when you look at the public health tracking of overdose deaths across the nation, this opioid epidemic is headed our way. We believe a recent narcotic operation in the Santa Clarita Valley is just an indicator of what's to come for Southern California law enforcement. We've seen a spike in overdoses in the month of April, but particularly during a 72-hour period at the end of that month. The first overdose was a 26-year-old female on April 23rd at 1 o'clock in the afternoon, who was then transported to a local hospital and then later signed herself out and left. Approximately 8 hours later, an overdose death of a 28-year-old male occurred in a park about 8 o'clock at night. The heroin tested from this particular incident did show a presence of fentanyl. 6 more overdoses were either transported or arrived at the hospital between the afternoon of April 24th and the early morning hours of April 25th. One of the overdoses on April 24th occurred in a restroom of a local business. Deputies responded and administered CPR until paramedics arrived and administered Narcan. The patient was stabilized and then transported to a hospital. During the follow-up investigation with the family, they indicated that the patient was an addict and in a residential treatment program. During the same time period, patrol deputies conducted a traffic stop and arrested one person for possession of heroin. That heroin, which looked like tar heroin, tested positive also for fentanyl. Through the investigation, detectives learned that the possible source of the heroin during the overdose time frame was coming from the same source in the San Fernando Valley. In an effort to stop the overdoses, narcotic detectives conducted 4 different narcotic operations between May 2nd and May 25th. These operations netted 6 arrests, approximately 20 ounces of heroin, $10,000 in cash, and 2 cars found with hidden traps to conceal the heroin. Detectives also recovered 1 package of heroin, also laced with fentanyl. I know we're simply not going to arrest our way out of this problem. We need to approach this differently. Our plan moving forward needs to be multifaceted and must include a team to address prevention, intervention, rehabilitation, as well as the enforcement efforts. The teams you will see standing with me today are just the beginning of a countywide response plan to interrupt the criminal enterprise behind the drug sales and create an integrated approach to saving lives. With me are members of the LA County Sheriff's Department Special Operations Division and Patrol, and also joining us today is Dr. John Connolly, the Acting Deputy Director of Public Health for the county, who's also our partner on the Safe Med LA. Safe Med LA is a consortium of public health, government, and law enforcement partners. We must examine what is driving the addictions and equip ourselves with knowledge. We must also gather the means necessary to insulate LA County from the opioid and heroin-related devastation that we've seen in other parts of the country. We need to research new and innovative methods to impact the tragedies brought about by the opioid addiction epidemic and consider non-traditional law enforcement roles to be part of the solution. Which brings us to our deployment of the life-saving drug Narcan, which you'll see here today. It is a small applicator that I'll talk a little bit more about. Deputy sheriffs are often first to arrive on scene of a medical emergency, which presents us with a unique opportunity to have an immediate impact on the effects of an opioid overdose. Until recently, deputies have been restricted in the level of care we could provide an individual suffering from an overdose, but fortunately, that has changed. Naloxone, commonly known as Narcan, is a life-saving intervention medication. It's now available over the counter to the public as well as to first responders. We're here today to proudly announce the Sheriff's Department will be equipping our field deputies with this valuable life-saving medication. Our pilot program will include issuing more than 1,200 doses of Narcan to our deputies assigned to Santa Clarita Station, Crescenta Valley Station, East LA Sheriff Station, Community Colleges Bureau, and our Parks Bureau. Through our partnership with SafeMed LA, a coalition dedicated to taking a coordinated and multi-pronged approach to address drug abuse, we were awarded a grant for an additional 5,000 doses, which we plan to get in the field in the coming months. This will provide nearly every deputy in the field this valuable life-saving tool. Narcan is very simple to use. It requires minimal training and is almost risk-free. The medication is dispensed through a nasal atomizer with one puff in the nostril of the patient, and it can be administered to any suspected opioid overdose, even on children who are as young as a year old. We want to ensure people suffering from this illness know that they can get help, recover, and go on with productive lives. The use of Narcan on a patient may not cure the addiction epidemic in this country, but not using Narcan to reverse an overdose gives that person another opportunity to be able to make a life choice. We want people to know addiction can be treated effectively, and certainly that recovery is possible. Without Narcan, there is often no choice, just the tragic aftermath of family, friends, and loved ones mourning an unnecessary death. The opioid epidemic is our professional responsibility, but it has a personal impact for members of our department as well. As we researched the department's response to this epidemic, we learned a member of my own command staff had experienced a family tragedy relating to the opioid addiction. She turned her loss into motivation, an intense commitment to make a difference in the battle, and she's led the way for our department's efforts as well. Her name is Commander Judy Gerhardt, and Judy is joining us today. Judy?
Good morning. First, I want to thank Sheriff Jim McDonald for his care and compassion and for having the foresight to recognize this impending crisis and for his willingness to do something about it sooner rather than later. I also need to thank my daughter, Michelle Payne, who's also a member of the department and has been my partner in this project, for all the work she has done to make this project come to fruition. I know for her it was a labor of love. I stand before you today with mixed emotions. On one hand, I'm so excited about what we're doing and the progress that we're making with this project because I know we're going to save lives. On the other hand, I'm devastated because I am the face of what opioid addiction does to a family. On December 28th, 2016, not even 6 months ago, my 23-year-old nephew, Maxwell Baker, we called him Mackie, passed away from an opioid overdose. He'd struggled with addiction since he was 15 years old, but in recent years, he was sober and in recovery. He was going to college, he had a job, he had a girlfriend, he was pursuing his dreams. He was committed to becoming a medical doctor like his dad and his sister because he wanted to help people that were struggling as well. He was in a car accident and required surgery on his hand. After the surgery, the doctors gave him opioid to control his pain medication, to manage his pain. A month later, he was found in the bathroom, passed away from a heroin overdose. We'll never know why he relapsed, and it doesn't really matter. It doesn't change anything, but I know my brother would have given anything to have a police officer there with Narcan to save his son from that fatal overdose, to give him another chance to live. Since his death, my daughter and I have been determined to do whatever we can so that other families don't have to experience the tragedy we've been through. We can't bring Mackie back, but his death doesn't have to be in vain. We hope that the use of Narcan by our deputies in the field is the first step of many to combat this problem. The message that I want to send on behalf of my nephew is to ask that we look at addiction differently. There is a stigma attached to it that prevents people from talking about it, but it's all around us. It crosses all walks of life. It could be your friend or neighbor, son or daughter, niece or nephew. We need to remove the stigma that's associated with addiction so that people who are suffering can and will seek treatment. Naloxone or Narcan is the first step to give addicts one more day to make that choice. Thank you.
I'd like to introduce our acting Deputy Director, Dr. John Connolly from the Department of Public Health Substance Abuse Prevention and Control Program. Doc?
Good morning, and thank you, Sheriff, and thank you to the Sheriff's team for having Public Health here today. I know we are so gratified to see this project come to fruition, to see life-saving drugs in the hands of our field deputies here in the county. And again, thank you to Commander Gerhardt for her story and for her commitment to this issue. I know that she has been a catalyst in this effort as well, and we appreciate her partnership. As many of these visual aids show us that the opioid epidemic has been an increasing problem, incredibly impactful on the East Coast, and we know that it's on its way here. While we have not seen the same rates of addiction and overdose here, we know that over the last decade that overdoses are increasing. We know that emergency department visits are increasing. We know that hospitalizations are increasing. And moreover, we know too many people that are struggling with addiction, opioid addiction, and we know too many people that have died and that whose lives were cut tragically short as a result of their addiction or overdose. The good news is that these tragedies have sparked action. So first, the Department of Public Health, in partnership with many county departments like the Sheriff's, have built a broad cross-sector coalition called SafeMed LA. And we know that a problem as broad and complex as this one, as opioid addiction and overdose, requires an answer and a coalition that is as broad and complex. And we are engaged in a variety of different activities that include safe prescribing initiatives to address opioid prescribing and painkillers among our physicians and our pharmacists. In addition, we're also leading different efforts to make sure that drugs that are unused are disposed of safely and don't end up in the wrong hands and misused. And of course, we have naloxone distribution action teams and law enforcement action teams, and those different action teams have come together to produce the kind of effort that you see today, and we're very proud that this project has finally come to fruition. It's been made possible by a grant from the State Department of Public Health. Our County Department of Public Health was able to secure naloxone support from that grant and get 5,000 doses of naloxone or Narcan nasal spray to the Sheriff's Department. And through a standing order of our county interim health officer, we were able to make that possible so that our field deputies could deliver that on the spot, out in the field, in the community, to people who need life-saving treatment as a result of an overdose. So again, I just want to reiterate that we are so proud to stand here with the Sheriff today. We thank him for his leadership and for his team's leadership on this issue, and we just hope we build an ever stronger and more innovative partner in the future. Thank you.
Thank you, Doctor. Let me open it up. Any questions you may have, one of us will be able to field it, hopefully. Sir? Hey.
Do you have any indication how often a deputy may encounter a person who has overdosed such that this Narcan nasal spray would be used?
You know, as we see in other states across the country, it's becoming more and more prevalent. And as mentioned, that deputies are often on the scene of something happening and then have to request paramedics over the radio. You know, they may get there in 2, 4, 6, or 8 minutes, but that's time spent, waiting that could have been used to treat and bring somebody back. And, oftentimes in cases like this, seconds count. So we want to be able to be out there. We rely heavily on our partners at the fire department. But if we can do something as an intervention before they get there, it certainly helps save lives. So to be able to speculate and give you a number how often, what I would say that we're seeing in other jurisdictions across the country, they're doing it, daily or a couple of times a week. Yeah. Yeah, we're very fortunate in that this particular drug, you can administer it to someone, and if they're not experiencing an overdose, it does no harm. So there are no ill effects, by administering this in good faith to try and bring somebody back. We still always call paramedics, get them rolling to be able to deal with whatever it is we're dealing with.
Do other law enforcement agencies have this now locally?
Locally, I couldn't speak to. I know that it's certainly on everybody's mind to try and be able to outfit our folks with whatever we can do to help save lives across the country, particularly in the locations where they've seen the greatest uptick in these overdose deaths. They are administering it at the field level by police officer personnel. Yep.
Approximately all field deputies will
Yeah, we're looking to pilot it with what we have initially here in the places I mentioned, which give us a countywide reach in the places most likely to see occurrences like this. As soon as we get the additional 5,000 doses, then we will continue to radiate that out throughout the county. And as we move forward, we'll get a read on what the problem is and how we're effectively dealing with it, to be able then to distribute any additional resources we can get where they'll make the the biggest impact.
And are these just a single press that releases the chemical?
Yeah, it's a little package here that looks like the top of a nasal spray, but this is the whole piece. You press the back of it, you shoot it through the nostril, single nostril into the nasal membrane. It goes into the body, and generally they estimate that within 2 minutes you see dramatic effects in bringing someone back from an overdose.
You said this was over the counter, this is available to the public if they have concern?
Yeah, this is something that will become available to the general public and certainly to our first responders. So we're very thankful that we were able to put in the hands of people who can have an impact this kind of tool.
Is there a price tag associated with it?
I believe roughly $75 for two of these. So it's still a significant investment. So we were very thankful to be able to get that grant to get this out on the street. We should be able to start rolling these out. We're hopeful Monday, and so we're going to put them into the field right away. Narcan is the brand name for naloxone, and so we're working with that one right now. As far as a particular pharmacy, we're getting them through the Department of Public Health, who's dealing direct.
Now, what drugs will they work on?
Opioids, yeah, opioids, heroin, that most commonly, but also what we're seeing is what's killing people is fentanyl and carfentanil. Fentanyl is, for those who aren't familiar with it, is a drug that was designed for stage 4 cancer and end-of-life treatment. It was done through a patch with transdermal application to go right in through the skin. We've seen it bootlegged recently, which is what our big problem is, and it's being put into heroin. The strength, if you will, of fentanyl on average could be 50 to 100 times stronger than morphine, and carfentanil, which is a derivative, could be up to 10,000 times stronger than heroin. So when you look at that, it's kind of an elephant tranquilizer kind of drug. When you look at that, the potential for somebody overdosing just by simply touching what would be a couple of grains of sand of this drug are significant. So certainly we have, for our first responders, we have a lot of concern as well. All right, thank you. Oh, sorry.
How long has this pilot been in the works? When did you first start?
Oh, we probably started 3 months. Yeah, about 3 months or so ago. We've been watching this across the country to see what we could project would happen here locally. We wanted to be able to get out in front of this, so we're not waiting for the epidemic to hit and then struggling to catch up with it. So I feel like we're already seeing cases, but we're on the front end of being able to be ready for what may come our way. We're hopeful that we don't see what other states have seen, but the reality is we know that more than likely we will start to see this. And again, really the importance of education for everybody in our community on what to watch out for. Talk to our young people about the dangers, the threats encountered by use of heroin, use of opioids, and the potential for death resulting. Well, thank you all for joining us here today.